Good morning, everyone. My name is Max Zuber, and in a way it's my fault that this session we're having this morning is titled the way it is. Last year, just before the cry went out from the AVA to suggest topics for this conference, I had a week where I had presented to me two dogs, almost identical presentations, both owners seeking end-of-life advice about their dogs. I assessed these dogs with them, history, clinical exam and so forth, sat down with them to talk it all through. The end result were two very different scenarios. I euthanased one on the spot. The other one we started palliative care, if you like, and it's still alive today. I had another one, and I'm going to talk to you a little bit more about that in a couple of seconds, but it got me thinking about the fact that I have over 40 years of experience in dealing with this situation, but I don't think at any stage I've actually had real professional guidance in how I should approach these matters. Palliative care is such a big area in human care, and I think we tend to gloss over it, dismiss it fairly lightly, don't pay enough attention to it. There's also the issue of, while in those circumstances we're trying to act as a dispassionate professional, it's very difficult in many of these circumstances to not be caught up in the emotion of the moment. And there's a cost to the veterinarian in putting themselves in that situation. There was a recent survey of relatively new graduates in the UK which indicated the most stressful events that occurred in a new graduate's life was in circumstances where they recommended euthanasia and the owners would not agree. So we've got a situation, an act for us to perform. If it all goes well, no one is happy. If it goes badly, it can be a disaster that is well remembered by you and your clients for a very long time. The third case I had that I want to share with you today, and I'll just give you a very brief background on this. It was a house call that I got asked to do. I had finally a vet student with me. It was a Great Dane that when I got there I decided in all likelihood it had a pathological fracture associated with a bone tumour. So a dog owned by a woman who had just finished nursing her aged father in her home. He had died 2 weeks before. The dog had been a major companion for the father and for her. Not only that, but she wrote and illustrated children's books. And the dog was a major feature in these books. A week after the event of euthanasia, I received an email with an attachment. And I'd like to share that, share that attachment with you this morning. There's perhaps an element in this that might be considered self-advertising, if you like, but look, I really felt that it was important that you got the whole sort of picture from this. I'll leave it for a second so you can just have a little bit of a look at the text of this. I haven't had a PowerPoint sent to me in these circumstances before. It's I still actually have a feeling of some degree of emotion associated with this case. So, hopefully, I've tended to just set the scene a little bit. Our first speaker this morning is Michael O'Donoghue. Michael is a BVSC graduate from the University of Queensland, and that was in 1992. He has practiced as a vet in Australia and the United Kingdom. After spending time at the University of California Davis Pet Loss Centre and working with Bonnie Mader, he became aware of the long-term impact of pet loss and endeavoured to help people in the area of pet loss. He researched the area of companion pet loss and the significant impact this can have on people's lives. In 2006, Michael met Penny Carroll and formed a pet loss support group called Pets and People. This was a long-held desire to help people who are grieving for their pets. Penny and Michael have been running pet loss seminars, maintaining a pet loss website, sell pet loss sympathy cards and coordinate pet loss counselling. www.petsandpeople.com.au. So could you welcome now Michael, who's going to take over our session this morning. Oops. Sorry, Michael. Get rid of that. We've got to get you on to the next one. There we go. Leave you to.
Thank you. There's a story about a beggar sitting on a box on the side of the road, and he sees a wise man approaching, and he calls out to the wise man, said, "Excuse me, can I have some money? I've got nothing." And the wise man says, "Sorry, I've got nothing for you." And the beggar says then, "Well, how about just a little bit of food? I haven't eaten all day." And the wise man said, "I've got nothing to give you." Then he says to the beggar, "What's that box you're sitting on? Have a look in that." "I've been sitting on this box for 30 years. There's nothing in here." And the wise man says, "No, go on, just have a look." And so the beggar gets off the box and slowly prizes the box open. And there inside the box is filled with gold, to his amazement and delightment. This story kind of illustrates the nature of this discussion, end-of-life decisions. It's one that's a gaining of wisdom, and sometimes it's about asking the right questions. So today I'm not sure whether I'm going to be the wise man or the beggar, because I want to be asking for your input into this really important discussion. So many people have great wisdom about that, and I don't have any great authority on it, but I just really want to coordinate people and to try and get the best out of all of us to this really important discussion. So this discussion is, I think, a really important one. It's about helping your clients through this last stage of their pet's life. So I'm breaking the talk up into two parts. The first part of the presentation is about helping people get to this decision. What kind of decision-making processes can we use to help them to get to the right decision? And then the second part is about the procedure itself, just setting the right stage for it. I haven't really gone into too many of the technical details, but more focusing on the client's positioning and just looking after the client. So in each of these two parts, I'll be giving you my thoughts on this topic and then some client feedback about what they've experienced in this process, and then I'll be turning over to you for your participation. So today I'm getting the talk videotaped so that we can record this session and then hopefully transcribe that to make it of use for everyone. So if you're wanting a copy of that transcription, I might get your name and address later and I'll get it back to you. I've also got extra handouts and we've got a pet loss workbook we're working on. We'd like to get copies of that out to people as well. So if you're wanting extra information, it'd be great to get your name and address or email address. So vets receive more cards, thank you notes and flowers after euthanasia than at any other time. They might have saved the pet, they might have done amazing orthopaedic surgery, diagnosed rare illnesses, managed difficult endocrine diseases, but it was only at the end that the client really felt thankful towards the vet. They were overwhelmed with how the vet did this last bit. It speaks volumes about the importance of this topic today, about how clients perceive it. So often we think the best things we do is in our clever knowledge, but in the end the client really appreciates when you do this part so well. Just personally, I've been working with these pet loss counsellors for several years, and I was thinking in the introduction, I've always had an interest in human-animal bonds, the human side, how humans are affected by pets. And I was motivated to go to the US, and I just happened to visit UC Davis and this pet loss centre, and I listened to a call. Might have been just pre-recorded, but I was really touched and moved by the depth and the feeling of emotion that a caller came through with. And I thought, wow, that's just blew me away. I kind of had a feeling that pet loss was something people had their pets euthanized, they cried a lot in the vet surgery, they went home and everything was okay. That to me was a touchstone point in my career to realise, wow, this is something really significant. It's deep affected emotion that lasts weeks and months and possibly years in some cases. I wasn't really sure what to do with that, but it was a conviction I had, and it was just meeting this lady, Penny Carroll and Grace, and they said, we are interested in pet loss counselling. I thought, well, here's my chance. I can really promote what these ladies do. And they're really remarkable ladies. They've got amazing wisdom. Sometimes I just sit down with them and have a really good chat, and I'm always blown away or really touched by their wisdom. There's something special. So, at this stage of life, at the end and on the last day, or just in those last few weeks, every word you say, every action you take will be thought about over and over again, sometimes for weeks, sometimes for months, sometimes years later. And they said, but the vet said this, or the vet was so compassionate. And so it just speaks volumes about how important this is to get it right. So we know that pet loss and grief is a very significant part of owning a pet. And as people become closer to their pets and spend more money on them, we're doing more to extend their quality of life, the length of their life, the more they bond with them. We live in a society where people are living on their own, their children move all over the world, pets are becoming more and more significant. And it's a lot of stages we're doing everything we can to extend that life, but we probably haven't done too much about helping them through the grief. And I think it's a really important part about the whole process of owning a pet, because we know that they're only going to live 12 years. Losing a pet is almost an inevitable part of owning a pet. Unlike your child, you're unlikely, it's a very unfortunate event to lose your child, but the depth of emotion can be similar in uniquely or specially bonded pets. So I just think we really need to manage it as a whole process. The pet loss grief needs to be part of this lifetime care of the client. So as I say, begin with the end in mind. We need to be talking about pet lifespans, doing senior programs, learning to manage and deliver difficult diagnoses, helping people make the right decisions at the time of euthanasia, and then following up and support afterwards. So I think this is about the lifetime care of the pet, and also we could extend that to the lifetime of the client, that we need to look after the client over a lifetime. I think Jim Stowe yesterday was talking about lifetime plans, and I think pet loss needs to be a part of that, and upfront about what pet loss is, that it's part of owning a pet, inevitable part of owning a pet. So pet lifespans, how old is my pet in human years is a very popular question, and such charts are always popular in vet surgery walls, and it just really gives us a good perspective about their lives, that it helps you understand that a rat might only live 2 years, a Great Dane 8, or a poodle 15 years. So these things are just fantastic at just putting things into people's mind about where the pet is and what to expect. Again, senior programs I think are really useful in this whole process. It might be the first time that people realise their pets are getting old, and it might be the first time that you deliver a diagnosis that the pet has arthritis or a heart condition, and it's sort of like the beginning of the end, but it's an important part of this whole process. So often the grieving might even begin at this stage, and it's important to know that you've got to help the client focus on that the pet's still alive and to really treasure those moments. So you can spoil the pet, let him sit up on the couch, give him scrambled eggs every day. The grieving does begin, but it's really important that the client can focus on the pet that he has right now, not on the pet that they might lose. So get them, make sure they spend plenty of quality time, take some good photos, get a video with their dog, and clients might realise then, look back and say, well, that was the best ever time I spent with the dog, not the worst time I spent with my dog. So knowing the right time, this is when it becomes all very tricky, and it's always the hardest part about owning a pet, and people always lament, this is just so hard, I can't even face this decision. So often people might cancel appointments, they make them, they turn up, they go home, they don't turn up. I think again we need to be really tolerant of this because it is such a difficult point in people's lives. If we can help them and be sympathetic to that, it goes down enormously well. So also, as vets, we often find struggling with this, where people want to extend the life forever, or people want to euthanize their pet at the slightest hint of old age. And I think it's a difficult part of being a vet, is letting people be there with their own bonding or their own perceptions of health of a pet. But I think it's really important at this stage just to be with that person in that way they deal with their animal and do the best we can. So personally, I've just come up with 4 simple questions that I like to ask people when they say, is this the right time? I ask them, is the pet still eating and drinking? Can the pet walk enough to get up and go to the toilet by itself? And is the pet still happy to see you? And have you had the pet examined by the vet? Some people often might ask this question over the telephone or just when they see you on the street. And I said, well, it's so important that the pet's been examined. I think if a pet's doing all those things, eating, drinking, walking, and it's still happy, I believe it has a good quality of life, and it's just a simple way to say that I think it's okay to continue. I just thought it was a fairly succinct way of putting it together, but again, I'll ask you later about your opinions about how you might help people, because I'm sure other people have really good methods or questions. And as I said, this asking the questions is the most important part about helping people make their own minds rather than telling them. The worst thing is being told by the vet or demanded by the vet for the euthanasia to happen. People find that quite traumatic. In your opinion, you think this animal should be euthanized, and maybe it's fair enough, but it's so important to let them come to that conclusion. And by asking questions is a key part of helping them come to that process, because we've just seen in the counselling, people feel incredibly traumatised when the vet rushed them into this decision. So that's just a key point again, The other thing is, I think sometimes people can't let go because they don't know how they're going to grieve. They can't face, what will I do without my dog in my life? How am I going to face this grief? And again, by making people aware of resources, that we've got books or counsellors or websites with great information, that can really help people let go, because sometimes, it's not always about the pet. People are in vulnerable emotional situations. They need to know that they have support. They need to know there's a process of grief, that it's a valid thing, and there's a way to grieve. So that's a really important thing in helping them come to this decision, is just supporting the person as well as looking after the pet. This is always a gradual process, and so often there's no clear line in the sand. But it's so important, I think, to make sure they've definitely had the dog examined. I find that tragic when people come down to the surgery to have the pet euthanized, and they've never had the dog examined by a vet, or it's never been to a vet before. It's the first visit, and you think all those things we could have done. I suppose that's part of how some people perceive vets, as they're only good for putting them down. They never ever go to a vet. But I think we need to continue as a profession to promote what vets can do, because there's obviously a lot of people there that don't feel it's worthwhile, but they come down, and I know the dogs, or a cat with hypothyroidism, they're really annoyed because it's begging them for food, and they're pretty annoyed at the cat. And I think that's almost pretty hard. They're wanting them to be euthanized, and they've never spoken to a vet before. So once people have made this decision, it's so important almost to switch modes and to help them with this procedure. So we're going to talk about that procedure later, but it's almost like, once they've made that decision, it's so important to just really support them in that, rather than go back and keep questioning it. Sometimes economic reasoning must come into this decision-making process. Either they could spend a lot of money and it might only extend the life's pet for a little bit more, or sometimes they just don't have any money at all, and the treatment might save the pet, just say in case of a tick paralysis or a blocked cat. There's a very good chance of survival, but the client has no money and they really must face euthanasia, and that's incredibly painful. But I suppose, unfortunately, it's a reality in a lot of veterinary situations. Sometimes people would go into a lot of debt to pay for their animals, and I think that always really humbles me about how hard people would put themselves in to save their pet. That truly humbles me. But I think it's also important that people don't put themselves into incredible hardship. I don't think their pet would want the owner to suffer. So again, I think it's about, you have to look after yourself as well. If a client's going to go without food or something, maybe that's not what the pet would want either. So sometimes people just have to be realistic and know that the best solution is euthanasia. As I said, it's just part of life that we have to balance these difficulties between our lives and the pet's life. So as I said, once the client's made this decision, it's so important to change modes and just help them do this. We were talking last night at the ASAVA dinner, and David was saying, he was talking about almost like talking about SAS soldiers, that they're trained to be killing machines, and they almost can go into a mode where the sergeant would say, "See that soldier out of the field, go out and kill him," and they go into this mode and they do this horrendous thing to kill a person. But the same situation is almost as a vet. We've got to go out and kill an animal, and it's almost like you've got to switch mode and just really concentrate on that procedure, and then you can switch back to the more compassionate person after that. So I did a bit of research on what else is out there about helping people make these decisions. And I came across this lady, Dr. Alice Villalobos, and a quality of life scale called the scale. So it's in the conference notes, but if you wanted a copy of this just as a sheet of paper, I've got one down here you can get later. So she came up with a sort of more an objective scale, a scoring system, and I heard people talking about Temple Grandis' evaluation of putting cattle to sleep or slaughtering cattle, and that she used a scoring system as well. And sometimes this really helps us to objectify something that's really tricky. So Dr. Alice Villalobos just came up with a scale, and the letters stand for hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. So it's useful that pet caregivers can then assess their own animals on an ongoing basis, especially if there's a deterioration over a long period of time and they're trying to look back and saying, is the pet getting worse or is it getting better? And to judge quality of life. So she asked people to give their pets a score on the scale of 1 to 10 for each of these measures. So like HURT stands for adequate pain control, including breathing ability, is first and foremost on the scale. Is the pet's pain successfully managed? What is oxygen necessary? Hunger, is the pet eating enough? Does hand feeding help? Does the patient require a feeding tube? Also, I think measuring weight is probably a really key component. I've thought about this, about the pet's quality of life. If there's rapid weight loss, is normally a fairly terminal sign. So getting the client to regularly weigh their animal is a really important key to measuring quality of life. Hydration, is the patient dehydrated? If the patient's not drinking enough, subcutaneous fluids once or twice daily can really help. Dedicated clients, I'm sure, can use subcutaneous fluids if you're shown, and that can often really help in their palliative care of the animal. Hygiene, the patient should be brushed and cleaned, particularly after elimination. Avoid pressure sores and keep all wounds clean. So again, the client needs to evaluate this and really helps them to pay attention to these elimination. Happiness, I suppose it's still really a subjective thing, but is the pet expressing joy and interest? Is the pet responsive to things around him or her, family and toys? Is the pet depressed, lonely, anxious, bored or afraid? Can the pets be close to the family's activities and not be isolated? Mobility, can the pet get up and without assistance? Does the pet need human or mechanical help? Or a cart? I've often seen that in the US they're much more into these mechanical carts than I haven't really ever seen them in Australia, but it's something that seems to be much more tolerated in the US about getting these mechanical carts. I haven't had much experience with them, but it certainly seems to extend quality of life for some pets. Is the pet still interested in walking? Is it stumbling? Some caregivers feel euthanasia is preferable to amputation, yet an animal has limited mobility but is still alert, can have a good quality of life. I mean, this is again a human thing that we have much less tolerance for a pet's amputation than a pet itself. We've always know that if pets can cope quite well with 3 legs, but so often clients can't. If you can help them understand that, you could really extend the pet's quality of life or the pet's life. And then finally, more good days than bad. When the bad days outnumber the good days, the quality of life might be compromised. When a healthy human bond is no longer possible, the caregiver must be made aware that the end is near. The decision needs to be made if the pet is suffering. If death comes peacefully and painfully, then that is good. So then the scores would be totaled, and a total over 35 points represents acceptable quality of life. Some people have found this really helpful, sort of more on a long-term basis, that they're measuring their pet's well-being over a period of time, and it's a way to sort of objectify the process rather than just having it in your head. So just a bit of client feedback. I do get a bit of people emailing me, but I thought I'd just read this client's email. I've just only got extracts of it. I did ask her permission to publish this, and she was quite happy to, because she just felt let down by the vet she was working with, and she just was happy that I could share this with you today. So I got Rafter's ashes yesterday. I've never in my life felt grief like this, not even when my beloved dad died. It's coming over me in waves. 1 minute I'm fine, and then I'm not, but mostly not really. I wish I was told back in June that it was a possibility that Rafter would live only a few more months, so I would have been more prepared. I would not have changed a single thing had I known that. It just would have made it easier on me, and more understanding of what he was going through. Then I feel guilty for even thinking that, because he was the one that suffered physically, not me. It's just been emotional for me. I don't regret what I did. I guess I just wish I knew how sick he would have been after coming home from having the IV fluids. I just expected him to be his usual self. I had no idea. So I know I did the right thing in ending his life that day, but I can't really get past the fact that I really do think I should have had things explained to me properly back in June. I can't move past it. I'm crying hysterically now while typing this. I wish I took him home for one more night and did it on Monday morning. But I didn't, because I had to go to work. I'm so horrible. I miss him so much, and I don't know what to do. Seems like he was here one day and gone the next. This lady was she really felt let down by this vet, because he didn't really explain this end of life. He didn't really give her a good prognosis about what the animal was in, or where the stage of the animal, and just about helping this client. And so she really felt let down by this vet. That's a real shame. So she's gone ahead and she's done a lot of grief work, and she's talked to our counsellors, gone onto Grief Lines and read some grief loss books, and now she's feeling a lot better. This is about 6 months down the track, and she's got a new cat, and she's feeling a lot better about life and about vets. But I think it's tragic that we just didn't explain about the end of life part, that this was the end stage, and helping her treasure those final few moments with the pet. Absolutely. Sorry? Well, yeah, I think, obviously people are very emotional, so it takes more than one explanation to get this through. And I said, it's about this whole process that a cat might live for 14 years, so it's not like in one consultation where we deliver these diagnoses, that it's a whole process. So, I'm sure that you all have a lot of other great points. So I really want to listen to you, because I know that everyone else will have some fantastic points about this whole process. So, I'm going to hand over, I've got some roving microphones, and we'd just like to pass it back to the other people about their experiences in helping people make this diagnosis, or does anyone else out there have ideas or ideas about helping people?
Michael, I think you probably treat clients who come to you a lot, and you're their veterinarian, perhaps a little bit differently from people who lob in from other veterinarians or who just use you as the last resort or port of call. Whenever I'm dealing with people who have just come in from the outside and I don't know them, I sort of insist on examining the animal because we've all had cases where animals are brought in when they don't really need to be put down, and I like to be assured that I'm not dealing with one of those cases. The other thing that I do is try and explain every option open to the clients, this is if I don't know them, so that they can make a valued decision right then and there. If indeed we have to put the animal down. So I put it back onto them, because often I think vets are asked to make the decision, particularly if there's no prior relationship. So I like to hand that back to the client. I don't know what psychiatrists think of that, but I think it has to be the people's decision. Guided by the vet, of course. The other thing I like to do, if we do have to put the animal down, is to ask the people whether they would like to stay for the procedure too. I think it's a mistake to shuffle them out of the room. You can take the pet out the back and put a catheter in, but I think the owners should be given an option to stay with the pet when the final deed is done, because I have had clients who've regretted not doing that, and I myself was in that situation too, and I think it's always very nice if the owners can be there at the end of the pet's life as well as the beginning sort of thing, and I think that's come back to be a good thing in most cases, but you give people the option, of course. Anyway, I just want to pass that on. I think with good clients, you've had many months perhaps to prepare them for the fact that the dog is going to die of cancer or whatever it is, and when the final day comes, the owners are well prepared. One thing I tell them is that the pet will tell you when the time has come, and in 99% of cases that's true, because they know their pets well, and they wake up one morning and they can just see it in the pet's eyes. But they're your very good clients that you have prepared well for the situation.
Thanks, Tony. So I'm just trying to really concentrate this discussion on helping make the decision, and the second half talking about more about that process, about letting the client be with the animal and how you do that. So just trying to really concentrate on helping people get to that decision in this discussion, this first discussion. And at the end, we're going to have a second discussion about the actual procedure itself, whether they're present, how you hold them, etc.
As being in behaviour practice, some of those guidelines are very challenging for owners. If we have a dog that they perceive is a happy dog, it is eating, it does greet them when they get home, all of those things are fine, but this dog is a significant risk, for instance, to a child in that household. I think that can make, sometimes directing those clients to websites that read those things can actually, in those specific circumstances, can sometimes be detrimental, because they tick all the boxes. for the animal being healthy. And I think, I see Jackie's in the audience here as well. I think we do, as behaviourists, we do spend a lot of time speaking to people about mental illness in animals, and that does tend to be overlooked in a lot of these scales, with these tick boxes, and that mental illness can be a form of suffering for these animals and can mean that euthanasia is the most ethically responsible decision to make. But I do think, I'm sure Jackie would share it, we get some of the most amazing cards and emails from people about the support we can give them, because often that there is a form of major disenfranchised grief often for clients who euthanize animals for behavioural disorders. And as a veterinary behaviourist, I think it is a big part of the work that we do is helping to support those specific clients. I think euthanizing an animal for a physical disorder can be extremely challenging and difficult. Euthanizing an animal for a behavioural disorder, I think oftentimes is another sort of level for owners to have to deal with. So I guess my comment is I think there is a place for some of these models, but I look forward to the day when mental illness will actually be included in some of these models that look at reasons for euthanasia.
That's a great point. I think, again, it's about, is the human bond, animal bond functioning? That could be just a simple question, because it's about, we're here to have a relationship, and if that relationship's broken down, that's the point of euthanasia. If there's no longer a human-animal bond isn't working, that is certainly a point of euthanasia. Yeah.
They love this animal, but they're making that decision. I think it's even. Yeah, I would say for a lot of those clients, that bond is still really strong. They love this animal, and they feel it's a choice between my animal or my child. So that just can be heartbreaking. And then you get into the issues. Well, is it ethically responsible to rehome this dog? And oftentimes it's not. So so I think. So just to make it clear, I think that bond is still really strong. If it wasn't, it would be easy for the clients, but it is still there. Thank you.
Right, thank you.
I agree with the last speaker's comments. I thought they were excellent. But one of the things I wish we were more careful with is the words we use. And killing shouldn't be a word we use as vets. Euthanasia is the giving of a gentle death. It's part of our therapeutic armoury, and it's something we have over medics. And there's so much negativity attached to it that when we use words like and equate ourselves to SAS soldiers killing an enemy soldier, the dog is not the enemy. We are not to switch off our compassion at any point. We must remain compassionate at all times. And there is slaughter of healthy animals. There's euthanasia, which is a therapeutic part of what we do as vets. We need to be a lot prouder of it and a lot less negative. And I think we'd have a lot less as vets, emotional issues if we understood the difference. And as a vet, having to put my animals to sleep recently, I understood what we as vets are to the client. We're the last person in the room. We're the only person who will stay with the animal. Everyone else leaves. It's us, the client, and the pet, and we're the last human the pet and the owner has to share the experience with. And if we're not compassionate at that point, we're not doing our job.
Thank you. Great, great point. Thank you very much.
I just think it's really important too that we remember that this discussion about senior care and coming to the end of life is not something we can always do effectively in a 10-minute consult with a waiting room full of people. And sometimes those consultations may need to be rescheduled for a quieter time.
Hello. One of the things I think that's maybe missing from the discussion is that there are times when we have to advocate for the pet. So yes, we do have to look after the owner, but when the owner's expectations are detrimental to the pet, one of the clinics I worked at, we had a dog whose bladder ruptured because of bladder stones, and the owner expected to be able to take that dog home and have her die at home. Now, you can't advocate for that. That's that's not fair to the dog, it's not good for her welfare. So we did have to talk hard and fast and pretty much force that owner into agreeing to a euthanasia. And I think that we cannot forget that while we have to look after the owners, yes, we have to look after the animals first. And if their expectations are so skewed, that's not fair.
Sure. Yeah, good point.
Thank you. In my experience in the past, a lot of owners often, I think, emotionally need that permission from the vet that it's okay, because I think a lot of people come in feeling very, very guilty about even thinking about euthanasia. And I know we shouldn't make the decision for them, but if they do ask our advice and we do think that really from the animal's sake it needs to happen soon, I think voicing that, the majority of clients are often actually very grateful for that, because it helps them to go where they need to go without feeling as guilty, like they're not the one killing their animal in their eyes. And I think as part of that discussion, it's helping them to realise that it really is a gift that you're giving that animal, and that it will allow them longer term to feel that they made a choice at a time frame when they didn't have a horrendous last few days because they couldn't cope with making that decision. So I'm not saying to force it on them, but I'm saying to offer them that opportunity of relinquishing some of that feeling of guilt.
Yeah, excellent. So it's like giving that advice, but still letting them come to that final decision. So it's a process of working together and coming to a decision together. So one more question, then I better get back to the second part.
Hi, I deal with a lot of euthanasia in my job, and I've found that it's particularly important to consider the children that are around as well. And I spend a lot of time actually differentiating between talking to the client and also talking to the children, because I tend to do it at home. So it's very much that, okay, this is the decision we need to make, or this is what we're doing, and then actually taking the time to speak down to the children and say, he has to die today, and they need to know it that way. They don't understand euthanasia. They have to know your dog is sick and old now, and he needs to die to go to the Rainbow Bridge, or however you want to put it. But I think that's something that we haven't always been encouraged to do, and I've found a lot of positive feedback in that it helps the clients, because they then don't have to go and tell the child why.
Thank you. Children often have very different expectations of what euthanasia is, and only the other day we were euthanizing a pet with the children present, and we put the dog to sleep and the heart stopped, and the little boy seemed, up to that stage he seemed pretty good, and then he started looking really puzzled and he said, is everything okay? He said, well, when's he leaving? And he said, when's the dog going off to heaven? He's just sitting there waiting for the dog to fly off to heaven. And it was like, oh dear, that was, the boy was sort of stunned then that the dog just didn't drift off into heaven. So it's always touching about little children that have different expectations of what a pet's death is. Just moving on to euthanasia, making sure it's a good death. Once this decision is made, I think it's most important to everything to make it a smooth procedure. So I haven't gone too much into technical details about this today. Other people might have really good technical ideas about getting the sedation right, placing the catheter correctly. But I just really wanted to relay some client experiences from their vets. So just to listen to the emotion of this feedback. It was one of the most horrible experiences I've ever been through. I'm so grateful that my friend was there. The staff didn't really help me in any way. I still remember that day like it was yesterday. Even though it was almost 5 years ago, my vet let me stay with Princess to say my goodbyes before euthanising her. And then he let me stay with her as long as I needed afterwards and gave me a comforting hug. And so did his wife who works at the vet hospital. I think as hard of a decision as it was to put her to sleep, they did everything they could to comfort me and my family at the time and afterwards, because they also knew that she wasn't having quality of life anymore. The fact that the vet could come to our home and do the process where our beloved girl was comfortable was truly the most awesome and powerful thing. It truly helped me with the process afterwards. They always send a card and are there if we need them. Almost nothing. They wouldn't let me go back to be with them unless I paid them $100 more, which I don't have. So I had to let them carry the pet off and not be the last face my beloved animals see. I hate that money has to govern every aspect of our lives, even in love and death. Everyone had a kind word, a hug, and we almost all cried. They reassured us we were doing the best thing for our pup and talked us through all our options leading up to our decision to put him down. They sent flowers with the card and also gave us a lovely ornament of an angel holding a puppy. They made sure his ashes were cared for and that we felt cared for as well. They genuinely loved our dog as much as we did, and that's all we could have hoped for in a vet. Oak Tree Animal Hospital is thoroughly amazing. My vet was amazing with Bronte. He let me stay as long as I wanted. He was very caring and gentle with her. When I went back to give him a thank you note, the receptionist said, "Oh, he'll want to talk to you." And he did, for a good long while, in a private office. He's an amazing person, and I'm very thankful for him. My vet left us alone with our golden retriever, Sophie, to decide on euthanasia or go on for another treatment that would extend her life. They let us stay as long as we needed. When we made the decision to put her to sleep, they gave her the shot and left us alone again for as long as we needed. The next day, 3 carnations in a vase with a sympathy card from our vet's office were delivered to our door. We love our vet's office so much that we use them again for our new 2-year-old Golden Annie that we adopted a few months ago. So just to summarise from these experiences, the best experiences was either like from a house call or a quiet consultation where they felt they had their own space, letting people be there when the pet was euthanized, letting them stay as long as they needed, displaying compassion, and then at the end to send a card, a flowers, or a memento, such as a hair sample or paw print. So those things are, just so grateful that people are just unbelievable and thankful if you can follow those procedures compared to the vets that didn't show any compassion. There was just a lot of people either devastated or amazed at the vets. So we're just running out of time. So again, I'd just like again to turn it back to the audience just to see if anyone else has unique ideas or perspective about this procedure.
There's an element of design in this too. I built a hospital and Randall, who sitting next to me, built a hospital with a special room, or mainly a special room for doing euthanasias. And my hospital had a back door, and the principle of that was that the people could slip out this special room through the back door without necessarily going through a waiting room full of jumping puppies and other people like that. Other people have mentioned having special time set aside, which I think is excellent too, so there's no other people in the waiting room if they have to go out of the waiting room.
Yep, great idea.
Just if I can quickly sort of address that question, and I guess put my own summary on all of this in a way, is that I think what we're talking about in this concept is the art of veterinary science, not so much the science of veterinary science. I sit on the Vet Surgeons Board, I did sit on the Vet Surgeons Board in Western Australia we did have a complaint about hugs from someone. At the end of the day, as long as you don't go the grope at the same time, in which case it becomes an issue of sexual harassment, which is dealt with differently. I think no one could accuse anyone of, the standard sort of hug, and I think the art part of it is, all of us having enough emotional intelligence to judge when it's appropriate and when it's not. Yeah. Sorry.
On that subject, when I have euthanasia, generally speaking, with most people, I'll just a gentle touch on the hand or the body, and then if they want a hug, they will come in for a hug, basically. I let them take the initiative.
I was just wondering what people's opinions were on the other pets of the owners coming to a euthanasia. I had a client ask me if she could bring her pet, and I was fine with that because she thought it would really fret when it went home and the other dog wasn't there. Is that something we should be talking to our clients about when we're preparing them for a consultation where they bring their pet in for euthanasia? If anybody has any ideas on that?
Well, I think I've found that pets certainly grieve the loss of their other companion, there's no doubt about that. And from what I've also read is that pets can certainly sense the other pet seems to have passed away, and they seems to have helped them to see the dead body. But I think it could also be just could be difficult in a small consultation room having another pet while you're trying to do a procedure. So that would be my thoughts on that, is to let the pet see the dead body can really be helpful to that pet. Okay, there you go. Yep, so yeah, best not to do it in the side of the other animal.
But
So,
bearing in mind, I think there's elements sometimes, again, you've got to get caught. Too. So, things can be illegal, but I think, again, if you use your emotional intelligence in a situation, I think if it's terribly important to the client, I don't want to get into an argument about it, about being illegal. Unfortunately, I think, in fairness to our next speaker, we're going to have to wind it up there, Michael. Yep. So if you'd all join me in thanking Michael.
So if anybody wants any more information or a copy of this video or a transcript from the video, just give me your name and address, or some stage later. I've also got some a flyer from this, from that scale, and a pet loss resource book.
All right, we'll just have a 3-minute break while we prepare for the next speaker, and we'll see everybody back very shortly.